Hello, everyone. I'm Gina Arias, and I'm thrilled to welcome you to another episode of TM Policy. And today we're going to be delving deep into the policy issues that affect moms, children, and families. And joining us for this insightful conversation is the incredible Dr. Pooja Lakshmin. Dr. Lakshmin is a psychiatrist, clinical assistant professor at George Washington University School of Medicine, and she is the author of Real Self-Care, which was an NPR Best Book of 2023. Dr. Pooja, thank you so much for joining us today.
It is such a pleasure to be here with you, Gina. Thank you for having me.
Dr. Pooja, we like to have our guests tell us a little bit about themselves in their own special way. Can you share a little bit about yourself, what inspired your advocacy, and what has guided your work?
It's always so hard to answer this question because I could talk for probably an hour, but we don't have that much time. So, I think what's important for folks to know is I am what's called a perinatal psychiatrist by training, or reproductive psychiatrist. I specialize in taking care of women, mothers, who are struggling with conditions like postpartum depression, postpartum anxiety. And for me, I was always interested in women's mental health and women's studies. I majored in women's studies in college, and um, I thought that I would be an OBGYN when I went to medical school, but then I realized that I hated being in the OR. So when I found this niche in psychiatry, it was just the perfect fit. But one of the things that I came to understand as I was going through my training, and I've been in practice since 2016, but in in perinatal psychiatry, we are taught things like, if moms get 4 to 6 hours of sleep postpartum every night, then their risk for developing postpartum depression or postpartum anxiety is lower. And I would think to myself, well, but wait a second, like who, what person with a newborn is able to sleep for 4 to 6 hours? That means that you have to have either grandparents there helping, you have to be able to have a night nurse, and it doesn't even take into account the decisions that you're making about feeding your baby. And so I kind of came to realize that there was really this gap in talking about social determinants of health and talking about social support and the ways in which your environment and the conditions and the resources that you have impact your mental health. And so that is a really big part. It informs why I do the work that I do, because I think as a perinatal psychiatrist, I can bring a unique lens to the advocacy conversation.
I want to start off by grounding us in some data. This week, we are celebrating Maternal Mental Health Awareness Week. And I think it's important for the audience to know that maternal mental health conditions are the most common complication of pregnancy and childbirth. More than at least 800,000 women in the United States are affected by maternal mental health conditions. And we also know another sobering fact that Black women are twice as likely to experience maternal mental health conditions, but half as likely to receive care. So that's just a little, little snippet, a little grounding around these issues. These conditions include depression, anxiety disorders, obsessive compulsive disorder, post-traumatic stress disorder, bipolar illness, and substance use disorders. And Moms Rising has a dedicated maternal justice team that has been working on maternal mental health, as well as other issues affecting moms in the perinatal period, such as the maternal mortality crisis, reproductive justice, and breastfeeding rights. So we're really delighted to have you, Pooja, here and have your expertise to talk about these issues. You mentioned social determinants of health. So I'm gonna frame it as the social conditions, right, that affect our lives. And we know that there is a connection between those social conditions and the mental health of mothers and other birthing people. So it's important to talk about them and how we can best support people, especially folks who are in marginalized communities. So, you know, keeping in mind the significant impact of these social conditions or social determinants on mental health, could you highlight a few that most impact people who have recently given birth, and how to promote good outcomes for pregnant people, despite the social conditions?
Gina, you went through some of the different factors that come into play when we're thinking about maternal mental health outcomes. Certainly, we know in the United States, Black mothers are experiencing, um, a crisis of maternal mental health in terms of mortality rates and also mental health. That the risk of not only experiencing something like postpartum depression or postpartum anxiety is higher, but the statistic that you highlighted, right, that it's even more difficult to get support. The other places that I see kind of social determinants of health coming together is in level of support. So single mothers in particular are at much higher risk, and it's much more difficult because as a single mother, you may not have the support network. And especially if you are working one or two jobs, you're dealing with how to, find childcare that's affordable. The other piece of this too is, do you have paid parental leave as a mother or birthing person? Or best case scenario, if you are with a partner, does your partner have parental leave as well? So there's so many factors that are not only dependent on your identity, but also dependent on your work and your employer, because in the United States we still don't have federally mandated paid parental leave. And there are studies that show, there was actually a study that was done in Sweden, which found that when fathers had 30 days of flexible paid parental leave, the prescriptions for anxiety medication for moms went down, I think it was 26%. So, I mean, that tells you everything that you need to know about social determinants of health. And it's not, and I do want to throw in the caveat, this doesn't mean that postpartum depression isn't real. It doesn't mean that this isn't a neurobiological illness. It is. And neurobiological conditions are impacted by your environment. It's a two-way street. It's not binary. So I guess getting back to the second part of your question, what can we actually do
Yeah.
not to feel so kind of depressed about this? Because we are not powerless. And knowledge is power. So understanding, what are your risk factors? Are you at higher risk? Are you a Black woman? Are you, a single mom? Did you conceive through assisted reproductive technology? If you've had previous miscarriages, you're at higher risk. So knowing your risk factors, if you've struggled with depression or anxiety or PTSD, if you've had prior trauma, you are at higher risk. So that means making sure that you're going to your OB appointments or your midwifery appointments. And that means telling your provider that, hey, I have this history. Hey, I know I'm higher risk. And hopefully your clinic is screening you. The questionnaire is called the EPDS. But if they're not, you should be also speaking up and asking and saying, hey, is there anything that I can do? I'm on a medication. Should I stay on it? I used to be on a medication. How do we know that if I should go back on it? And I say this with also with the acknowledgement that especially for women of color and women in marginalized groups, there's a lot more stigma of bringing these concerns up and talking about mental health. And I know, especially in some communities, there's a worry. If I bring this up, are people going to think that I'm a bad mom? Is CPS going to be involved? And those concerns are real and true.
Right.
And I think that's why it's just so important that we have this continued advocacy to really fund more resources for women that are in these communities so that you can find a provider that looks like you, that understands, that isn't going to judge you. I mean, there's research out there that shows, especially for Black patients, that there are better outcomes when their provider is also Black. So, I think the solutions, I'm of the mind that the solutions come from the top and we need pressure from the bottom to keep trying to get there.
All that you are saying is reminding me of when I was, my son was little and I was a single mom and I was definitely dealing with, you know, I don't even know if it was, I can't say it was clinical depression. No, I don't think anybody ever asked me, but I probably wouldn't have, said either, you know what I mean? Because of the cultural piece that you're talking about. I was asking my mom the other day, I said, has anyone in our family that you know of ever had like therapy for anything? She goes, therapy? No, we give ourselves therapy. That's what she told me. So yeah, so there are so many layers to um, acknowledging what's going on and getting the help that that could be useful.
Yes. And if
Um,
you don't mind, I want to just piggyback on that. It's funny because I had a similar conversation, or remember having a similar conversation with my mom at some point years ago. My family's South Asian, and it's a similar kind of thing. Like, well, why would you pay somebody to just tell them your dirty laundry? No, you keep that inside the family. You don't go out of the family and talk about what's going on. So that stigma is certainly real. And I do think, especially for the Moms Rising community, one of the things that I've found is that even when you're done having babies, moms, like becoming a mother is something that changes you to such a degree that I find so many moms that want to give back, want to do more for the next generation. So you can think of yourself like, think of, even if you are not in the position to be giving birth, maybe even when you're done with that stage of your life, can you be there for your friends? Can you be there for your cousins? Can you be there for your younger sisters or siblings? Um, because sometimes it's not the medical system that is the first touch point. Sometimes it is a peer, and somebody just asking you and saying, hey, I was watching this webinar the other day and they were talking about postpartum depression and anxiety. And I was just, I just want to check in on you. And I know you just had the new baby and there's a lot going on. How are you doing for real?
So, speaking of moms and giving back to the community, you've been teaching a virtual course called Pregnancy, Postpartum, and Mental Health. Could you talk a little bit about that course? It's a 4-week course. What inspired you to develop the course? I know it's aimed at equipping mothers and birthing individuals with tools for a healthy pregnancy and postpartum. But was there a personal experience or professional insights that led you to creating this course?
It's funny. I originally started teaching this class in, I think it was 2020, 2019, 2020, right in the very beginning of the pandemic. And my impetus for teaching it actually was a little bit ragey, in that I was getting really frustrated that on social media there was all of these classes about how to give birth, how to have a vaginal delivery, how to breastfeed your baby, but there was nothing about mental health. And like we were just talking about, mental health conditions are the number one complication of pregnancy. So where's the education about that? And and I also know that psychiatric care is really inaccessible. It's really hard to find a psychiatrist that you can afford, let alone a perinatal psychiatrist. And so much of my job is educating. So I came up with this idea to do these Zoom courses. And, it started out as just 10 or 12 women, and it would be 4 weeks. And we would cover kind of the signs and symptoms in general of what to look out for, some of the evidence-based strategies that we know that work for reducing your risk. Obviously, you can't 100% reduce your risk, but there's things that you can do that do make an impact, like thinking about your support system ahead of time and communicating with them. Looking at what's going to happen with sleep and looking at your risk factors and thinking about your feeding decisions in relation to that. And then providing some kind of coping skills and also some understanding about the risks and benefits of psychiatric medication. So I started that back in 2020, and I've been holding these classes almost every year since then. And we've come up with now a more there's an asynchronous version, so you can watch the videos where I'm teaching, and then there's also written material. And this is the type of thing that, in the same way, where you're kind of taking your newborn 101 class and your breastfeeding class, this is a nice companion to have, because you no doubt are going to be in that postpartum period. You're going to be having moments where you're wondering to yourself, is this normal or is this not normal? And by having this resource at hand, you will know, and you'll be able to then advocate for yourself with your provider. um, I've the most telling feedback that I've gotten in teaching this class over the years is moms who write and they say, because of this class, I was able to find a therapist. Because of this class, I brought up my symptoms with my OBGYN and I went back on my medication,
That's
things
awesome.
like that. So it's really kind of, I think it helps give you confidence too, because everything's research based and there's links so you can look at the actual studies and things like that.
Mhm.
Because there is this power dynamic when you're sitting in the doctor's office and you know that they have like 15 minutes for you and you're not sure what to bring up and you don't want to seem like you're, too stressed out. But if you have some of this language ahead of time, it can be really helpful to communicate your needs.
And you have a clinical practice. Could you talk a little bit about the difference between what you can teach through a course versus your clinical practice with patients?
Sometimes I kind of describe it as the difference between taking an exercise class versus having a personal trainer. That's not a perfect example, but when someone is your doctor, like the people that I work with clinically one on one, the uh, treatment plan is very specific to that person's unique risk factors, their family of origin, what their work situation is, how much support they have, and also their own personal history, whether they've taken medication before, whether they have a history of trauma, whether they've been severely depressed before. And then I'm working closely with that person to prescribe medication, to do psychotherapy, or to refer them to a trauma specialist or whatever it is. So that is actual treatment, because it's individualized for you and your specific needs. Whereas the education piece is, here's the research, here's what we know on a group basis. These are the biggest risk factors. And that can be a helpful adjunct, but it's not a replacement for treatment. And I always like to emphasize that with my patients when I'm teaching classes. I'm a doctor, I'm not your doctor. I don't know everything about your life and all the different considerations, but here's all the background information and here's what you need to know in an accessible way, not in like a textbook way, because nobody wants to read a textbook, and you shouldn't have to read a textbook. Like you're not going to medical school, right? Um, and I do think, for this is a little bit of like a controversial topic, in that there are definitely physicians out there that say, well, you shouldn't be doing that, right? Like you should just only work with your own patients, and we shouldn't be blurring this line between education and clinical work. And I would say, actually, I don't agree with that, because when physicians aren't putting this information out there and aren't actually teaching new moms what to look out for, because they're not getting it in other places, people will find it in less reputable sources. They will turn to influencers, they will turn to wellness nonsense that isn't actually evidence based. So I do think that we need to have physicians out here sharing this information in a way that's accessible, that's not academic, um,
Sure.
because
And they'll
otherwise,
turn to,
where are you
sorry,
going to get it? Yeah.
I was thinking they'll turn to their moms who will say,
You're fine. Don't worry
"Well,
about it. Everybody
touch
feels that way.
therapy.
Yes. Yes,
Let
exactly.
yourself off."
Right.
Right. Yeah, for sure. You touched a little bit upon some of the topics, but could you, if I was interested in signing up for this course, could you delve a little bit more into the key topics, modules, what a person could expect from taking this course?
So it's broken down into 4 weeks, and the first part of the class, we talk about sort of the normal, quote unquote, normal experience psychologically and emotionally during pregnancy and postpartum. One of the reasons that I decided to include that in the very beginning up front is because I also think that we don't do enough to talk about just like what the normal thing is and the range of normal, because there is such a range of normal. And the process of um, being pregnant, growing a baby in your body, and giving birth to said baby is a huge shift in identity. It's a huge shift psychologically. There's so many changes that happen from a psychological standpoint, let alone a hormonal standpoint, right? And how they come together. So we spend some time talking about that. And then we dive deeper into then the what to look out for. What are some of the signs and symptoms, and what are the risk factors? Again, because there are so many risk factors, whether that's having a previous history, whether you're somebody who's been through IVF, thinking about your race and your level of resources. So we spend time there, and then a good portion of the class also goes through different types of medications. So, specifically, antidepressant medications and anti anxiety medications, talking about everything that we know about the risks and the benefits to taking these medications. And, goes through the primary studies and the research over the years, what things to think about and consider as you're thinking about making this decision with your clinician. I like to also end on an optimistic note in the class, in kind of empowering folks that are taking it to really focus on where you have agency in this process. So once you've kind of gone through the models and looked at, okay, what risk factors do I have? There's an area to kind of put in place your own plans for who's going to be my support. What is my sleep protection plan? What questions do I want to think about asking my provider? And then you have kind of that resource there when you're in the throes of the postpartum period and sleep deprived and not sure what to do, that you can look at that. The other really nice thing that I've seen happen with the class is that you can share it with your partner if you have a partner. And they can watch the videos, they can read through the text, they can click on the links and look at all the research themselves, and see how important sleep is, or see how important therapy is if you have a history of a perinatal mood or anxiety disorder. And I wish that it wasn't this way, but the reality is that we live in the world that we do. I do think that in heterosexual relationships, um, sometimes it can be hard for women, for men to totally understand the experience that women go through in that period, postpartum in particular. And I think there is something about having a credentialed expert laying out all the data and saying, here, actually sleep is really important, so you should have your in-laws come, you should have somebody there with you, so there's another person so that you can take naps during the day, or you should it's actually really important that you have a babysitter a couple times a month so that your wife can exercise, or whatever it is. Having that external professional having an external professional say that sometimes is more powerful than hearing it from your spouse.
Well, it sounds like a tremendous resource, as is your book, which I'd like to talk a little bit about. Your groundbreaking book, Real Self-Care, a transformative program for redefining wellness. And in the book, you delve into the complicated challenges that many people face when trying to balance the 40-hour work week with no childcare. I remember it well. And yeah, you immediately, if you didn't make a plan, you have to make a plan, and you have to get it together. It's so many people are dealing with this, and I want to start by asking you, within this context of modern day life and all of the responsibilities, how do you define real self-care? You talk in the book about faux self-care, so if you could break that down a little bit, I'd love it.
I often say that you, like you mentioned, Gina, that you can't meditate your way out of a 40-hour work week with no childcare. That's not how real wellness works. And when I use the term faux self-care, what I'm talking about is these band-aid solutions, like the juice cleanse or the bubble bath or the bullet journal, whatever it is, that are band-aids, that aren't fixing the core problem, which is that we need a top-down approach. We need things like federally mandated paid parental leave. We need access to good health insurance, all of these types of things. Um, and like I said earlier, I do think that we have to be like we live in the world that we live in currently, and we need ways to buffer ourselves. Audre Lorde said self-care is self-preservation, and that had a very specific meaning as a Black queer woman.
Mhm.
And the four principles, I lay out four principles of real self-care: boundaries, compassion, values, and power. So while something like a bubble bath is a method, it's something that you use as a band-aid to escape and escape the stress. And I'm not saying that's bad. We all need that once in a while. But it's an escape, it's a relief. It doesn't actually fix any of the core problems. The principles, though, a principle is something that you can make your own. A principle is something that you apply to your own situation, your own life. So boundaries, compassion, values, and power. Um, these are uh, these are internal processes, and because they're internal, they're sustainable. They come from you. They're not something that you have to buy. It's not another thing to check off of your to-do list and then feel guilty about because you're not doing it. And it takes into account that we're not exonerating the systems that are the source of the problem, but we are saying, look, we live in this system and we have to find ways to buffer ourselves. And in the best of circumstances, when people do set boundaries and when they do act in, you know, when they do practice the principles of real self care, there are examples where systemic change happens, either in the workplace or in your community. I have examples in real self care of, people advocating for paid parental leave or getting time off or things like that. Those examples aren't because that person wanted to be an advocate. The examples happen because they started to set boundaries and give themselves compassion and then realized they needed something and asked for it. And because they asked for it in the system, then that change impacted everybody else too.
I could see how that could be really hard for somebody. I'm thinking about my mom actually.
Yeah.
I'm always telling her, you have to set boundaries. Because she gets pulled in so many different directions. I mean, how do you talk about in the book unlearning, the process, for example, of not setting boundaries? How does one learn to do that? Do you give tips for that? I guess I want to get a little bit more into the nitty gritty of these principles, which sound great.
The disappointing answer is that you learn boundaries slowly. But the good news is that I do share in Real Self Care a framework for boundaries that is a little bit different, because I think that saying no is not always accessible to everybody. Saying no always, it does come with a cost, whether that's financial or emotional. So I actually think of boundaries as the pause.
Hmm.
So somebody asks you for something, an email comes in, a request comes in from your kid's school, you pause, and then you always have three options: yes, no, or negotiate. So you might not be able to say no right at that second, but at least you can imagine and you can consider. And then you do the calculus in your mind. And you might say, you know what, I do feel like I have to say yes right now. I don't feel like no is accessible. Then you can make a note for yourself and say, okay, what do I have to do so that 1 year from now or 6 months from now, I I can feel like no is a little bit easier or is a little bit more within my reach. And usually with women, in the caregiving situation, it's having to do with relationships and feeling guilt or feeling like that person is going to be upset with you. So then you can take some baby steps to start to set put some distance between yourself and that person. By distance, I mean emotional distance. This is a hard process. I'm not saying that this is easy by any means. And I think that especially for a generation of women, um, you know, an older generation of women, this is something that comes with a lot more fear than a younger generation. So you're having to really kind of unwind so much social conditioning and culture and just everything that you've learned. But I will say, I got an email recently from a woman who was in her 70s who read Real Self Care, and she said, "Pooja, I'm in my 70s. I thought that there's no way that this book could actually help me because I'm in my 70s. I can't. It's too late for me to change." But it did help me, and I have started setting boundaries, and my relationship with my husband is so much better, and etc. And so I just thought that that was such a touching example of like, it's never too late. It's never too late.
Awesome. I love that. I am going to pass my copy of the book along to my mom. She's also in her 70s. That's awesome. That's awesome. So, you touched upon those feelings of guilt, the societal expectations, right, that are placed upon women, in particular. Um, for those who are struggling with those feelings, what advice can you offer to help them overcome these obstacles and to try to prioritize their well-being, without hesitation?
Well,
Besides
there
reading the
will
book.
always be hesitation, and because we live in a patriarchal culture, and our entire economy runs on the unpaid or underpaid labor of women, more specifically women of color. So you will feel uncomfortable, you will feel guilty. So I think you have to reframe it to understand that just because you feel guilt doesn't mean you're making the wrong decision.
Mm.
You'll
Say
feel
that
guilty.
again. Could you say that again?
Yes. Just
Right.
because you're feeling guilt doesn't mean you're making the wrong decision. Guilt does not have to be your moral compass. So it's not about not feeling guilty. It's actually about the work is tolerating the guilt, and just turning down the volume a little bit, just giving it less power. I like to talk about this metaphor from acceptance and commitment therapy about the broken check engine light. So imagine you're in your car and the dashboard where there's all the different little lights that go off. So you've just taken your car to get serviced, the oil's changed, everything's good, and then there's this flashing light that keeps going off. But then you take it back, and the mechanics are like, "No, everything's fine. There's nothing wrong. The light's broken." It doesn't actually give you any valuable information. You don't have to listen to it. You don't have to turn around and follow it because the guilt is always going to be there. Like the guilt is going to be there. And your job is to not jump at its every command.
Exactly. I love that. Well, we have learned so much from you today. This is a really important discussion about maternal mental health. And we know that we have really a long way to go before we get to where we're in a better place and moms and birthing people do not have to suffer in silence and suffer so greatly, as many are. Um, we shared some good resources, the book, of course, your book, and the course. Are there any final words or any key takeaways that you'd like to leave us with?
I think I would just say that knowledge is power, and to remember that that you don't have to suffer alone, and that um, and to check on your friends too, to keep having these conversations openly.
Especially those strong ones.
Yes,
Check on them. Check
yes,
on us.
yes.
Thank you, Pooja. Thank you so much for being here today.
Thank you, Gina. It's been such a pleasure to be with you. Thank you.
Thank you for joining us for another episode of Tea and Policy. For more information, follow us on Instagram at Moms Rising. And for more discussions like this, follow us on YouTube at Moms Rising.